this video is to remind and educate about proper blood culture collection technique. Let's get started. Step 1 is don your PPE. Now you're ready to collect blood cultures.
Let's talk about the supplies we're going to need to gather in order to draw a set of blood cultures. First things first, you're going to need your blood culture bottles. If you're doing an adult set of cultures, you will need these two bottles. It's the blue bottle with the silver cap and the purple bottle with the purple cap. You will need both for a set of adult cultures. If you're doing pediatric blood cultures, we have the bottles with the pink cap. You only need one of those. The other thing we're going to need is a diversion device. In our case, we have a red top tube with no additive. The point of this is to reduce contamination by putting the first little bit of blood that may still be contaminated with either the patient's skin, bacteria, or anything from our initial stick, putting that in here so that way that bacteria and potential contaminant doesn't end up in our blood culture bottle. It ends up with a cleaner sample. So this is going to be drawn first. That's why we get 3 labels when you print out your lab culture labels. The one of them goes on this tube, and then you have 2 for your bottles. We want to try and get the blood from the patient to the bottles in as few transfers as possible in order to reduce contamination risk. So you're going to need a couple different options for making that happen. The gold standard is to do a straight stick for our patients. So if you have your butterfly needle, we also have this for our vacutainers. These come separately, so when you're connecting them, please make sure that when they come out of the package, we're not touching them. We keep them as sterile as possible and connect these together. It's just a lure lock. And then you have your butterfly needle and your transfer device that can go straight onto your blood culture bottles. If you're using that method, you will need to prep the skin. You can use either an IV start kit, or we have the ChloraPrep separately, so you can use this or your IV start kit. If you are doing an IV start instead and drawing your cultures from there, it is acceptable to go ahead and use your start kit with the CHG scrub in there. And then what you would do is start your IV, you have your catheter in the patient's skin, and then you'd use that same vacutainer. Again, keep it as sterile as possible, make sure it's not touching anything, and connect that straight to the catheter. It is best practice to not draw our blood cultures through an extension set, so you need to draw them before you attach the extension set to your IV catheter. However, if you must, say you have an IV that's already been established, you can use that IV as long as we know the skin has been prepped properly, and we'll talk about that in a little bit. You can use that IV, and if you have to draw through the extension set, please just make sure you scrub the hub of that extension set really well with Prevantix before you attach your vacutainer to it, just to make sure it's as clean as possible. So I mentioned Prevantix a couple times here. That is what we're going to be using in order to clean the tops of the bottles. So there's these little swabs called Prevantix. It is a mix of alcohol and CHG. It has been proven to be the most effective thing to kill the most amount of bacteria. So we use these on our blood culture bottles. The best part about them is it only takes 5 seconds to apply it and 5 seconds to let it dry. So it's a very quick application and dry time for our bottles. In addition to using Prevantix on the tops of our blood culture bottles, we're going to be scrubbing the top of our diversion device as well, just to make sure we kill any bacteria or potential contaminant on that tube. Before we collect our cultures, let's talk about the minimum fill volume and the optimal fill volume of blood that is needed for each of these bottles. These two that we use for our adult patients, the silver top and the purple top, need 8 to 10 mLs as an optimum fill volume. However, the least amount that can go in them is 3 mLs. Please make sure that you are striving to obtain the 8 to 10 mLs for each of the bottles, because that provides the best sample for these particular bottles. But if you can only get 3, that's the minimum in each of these. The pediatric bottles, the minimum is 1 ml. The optimal actually depends on age. So the criteria for about age 4 and under is going to be you'll take their age plus 1 ml, and that's your optimal fill volume. So if you have a 2-year-old, we want 3 mLs in this bottle. For your 3-year-olds, 4 mLs in this bottle. Once you get to about age 4, it is acceptable to move to the silver top bottle and use 5 mLs. We can do that, and again, keeping with that, okay, age 4 gets 5 mLs, age 5 gets 6 mLs. You can keep with that until about age 10. At that point, we should be switching to both of the adult bottles and doing the 8 to 10 mLs for both bottles at age 10 or older. Now let's talk about collecting your blood cultures. So first things first, we're going to put on some PPE. I've got some new gloves here. And what I'm going to be demonstrating in this video is collecting my blood cultures and my blood sample with a straight stick and a butterfly needle. However, like we mentioned before, you may be doing an IV start as well, so just adjust your equipment accordingly, but same exact process applies. What I'm gonna do first is go ahead and scrub the tops of my bottles and my red top tube with Prevantix. Again, it's 5 seconds scrub time and 5 seconds dry time, and it's to make sure that the tops of those bottles are as uncontaminated as possible. So I'll go ahead and pop off the tops of these blood culture bottles. Put out my Prevantix. And I will scrub these for at least 5 seconds. And then same thing with the red top tube. I'm going to be drawing that before my blood culture, so I'm going to scrub this for at least 5 seconds. With the red top tubes, it's a little tricky. We want to try and fold the Prevantix and get kind of deep down into that like hole at the top, because that is what's going to be in contact with the needle, and we need to make sure that's scrubbed as well. So I kind of fold it, dip it in there, and again scrub for 5 seconds, and the top as well. So we'll keep those as clean as possible. And now I'm ready to look for the vein that I'm going to be puncturing on my patient. So I'll go ahead and place a tourniquet. I like to put my tourniquets over the gown just because they're bright orange on top of blue. Sometimes we forget to take off the tourniquets for our patients, but if I see this bright orange tourniquet on top of here, I'm much more likely to remember to take it off. So that's just my tip for them. And then I'm going to palpate and see where I'm going to go for my puncture on my patient. So I'm going to go probably right here with a good vein here. What I like to do is take either a cap or the tip of a syringe and mark where I'm going to go on my patient. So I apply either a little bit of pressure with my fingernail or, like I said, a cap or a syringe. I apply a little bit of pressure and make a mark, because once I clean this patient's skin, I cannot repalpate it. And we'll talk about that in a little bit, but I cannot touch it again once it's prepped, or else I'm going to have to prep it again. Once I've made that mark, I'm going to prep my patient's skin with CHG. And again, you have it in your IV Start kits, or you can open up a brand new scrub like this. We need to scrub the patient's skin for 30 seconds. So I'm going to go ahead and start scrubbing. And then we want to make sure we're applying at least a gentle pressure as well. It's actually the combination of the CHG and the friction from our scrubbing that kills the most bacteria on our patient's skin. So you want to make sure you apply a little bit of friction. Obviously, be cognizant if you have an elderly patient with frail skin. We don't want to cause skin tears or take that skin off, but we need to make sure we're giving a little bit of gentle pressure to kill that bacteria. So you're going to scrub for the full 30 seconds. I know it feels like a long time. We've got to make sure it's as clean as possible. So once I have that done, like I said, I cannot repalpate that skin. This area is now cleaner than anything else I have. My gloves are not as clean, they're not sterile. Any of my supplies are not as clean. I cannot retouch this area, or else I'm going to have to re-scrub it for that full 30 seconds again. You don't want to wave across the patient's skin because that introduces bacteria. You don't want to blow on it because that introduces bacteria, and you don't want to touch it. So please remember, if you touch, wave, or rub, you must re-scrub. So once I have that completely dry, I'm going to go ahead and assemble my butterfly needle. So I have a butterfly needle and then one of the vacutainers. I'm going to put those together. And we want to make sure, again, things are not touching anything else as much as possible. So I'll take the cap off of here, attach it directly to my vacutainer, and then I still have the cover on my needle. With these bottles and with the red top tube, you're drawing the red top tube first, because that's going to collect any waste or any contaminant that might still be there. So that's our diversion device, that's getting collected first. I go ahead and preload my vacutainer. I don't deploy it, I don't press on there. I don't press it to go ahead and deploy the vacutainer yet, but I keep it on there, that way when I've accessed, I can go ahead and press and it's already loaded. So I'll take the cap off of my butterfly needle. I'll go ahead and apply traction below where I'm going, but again, I'm not touching the area where I marked that I'm going to go. Go ahead and puncture the skin. And once I know I have access, I'll go ahead and deploy my red tube and start collecting that waste. You only need about 1 to 2 mLs of waste. These tubes do hold about 5 or 6 mLs, so you don't have to completely fill it, but at least 1 to 2 mLs just to get any leftover contaminant in there first. And then you'll go ahead and take off the Prevantix. The blue one goes first. Make sure that dries for 5 seconds before you deploy it, and then go ahead and collect your samples. With the blood culture bottles, it's a good idea to mark these first. So there are lines on here that say how much blood or how much volume is in them. However, if you don't mark it first, it's really hard when the bottle is sideways to see how much blood I have in there. So I like to take a Sharpie and mark the line of the media first. That way when I start filling my blood, I can kind of tip it vertically, see where I'm at with the blood, and then keep going if I need to go ahead and draw more blood in that sample. After you've done both of your blood culture bottles, so again, I'll let that dry for 5 seconds, collect my second culture bottle, and then I will continue with my rainbow tubes if I need further samples. After that's done, I'll go ahead and pop my tourniquet and apply a gauze pad to my patient's arm and pull that needle. Once you've collected your blood cultures and your red tube, it's time to label them. You get 3 labels that get printed out for each set of blood cultures, and that's because we are labeling the red tube and sending that to lab as well. So you're gonna label all of them, and on the labels, please also write the date and time that the blood was collected, the initials of the person who collected it, the site it was collected from on the patient, and then the volume of blood in the tubes as well. Let's talk about some common problems you may encounter when you're collecting blood cultures. One of the first common problems we have is that our patient comes in with an EMS line and that may be all they have. As a reminder, unfortunately, we are not allowed to draw cultures off of field lines. We do not know the conditions under which that line was placed or the skin prep that occurred beforehand. We do need to start another line on our patient or do a straight stick if you do not need another IV. Another common problem we have is if we just cannot get enough blood. Either we don't have very good lines or a patient just is too dehydrated, they're just not giving us enough blood. In those situations, again, please remember that the minimum fill volume for the purple top and the silver top bottles is 3 mLs. If you truly cannot get 3 mLs for each bottle, lab's preference is that you send only the silver top bottle because it is the aerobic culture. Please get as much as you can, even if it is 3 mLs or less, and collect it in the silver top if you can only send 1. The pink pediatric bottles are also acceptable in this case, but if you have this set of 2, please remember the silver is the preferential one. Let the provider know, let lab know, and document that in the Epic that that's what happened. What if you are the person who is scanning and Epic and documenting, but you did not collect the cultures? That's also another common problem we run into when we work in teams. There is an option in Epic to change the collector's name at the top of the screen. You can change and say, even though you're the one scanning them, that another person did collect them and give them credit for their good blood draw. Another issue is if your patient only has 1 good IV and you just cannot get another. That's fairly common in our patients that we're having trouble getting access in. If you cannot get another line and you have attempted, please let your provider know. Please document an Epic. In the end, what we'll need to do is draw both sets of cultures off of that same line as a last resort. Please wait 15 minutes in between your 2 sets of cultures, and please scrub the hub of that IV catheter very well with Prevantix. Again, it only takes 5 seconds to scrub and 5 seconds to dry before you can pull that culture. Another common issue is if we are almost at the hour mark for our sepsis bundle and we just cannot get cultures either because of access issues, because of optimal fill volume issues, we just cannot get those 2 sets of cultures. That happens. The antibiotics are going to be the most important thing for that patient. Please do not delay antibiotics in order to get those cultures. Try your best, but if it's not happening, tell your provider, document an Epic, and give the antibiotics. Please document that you did not get both sets of cultures before the antibiotics were given. Thank you for watching the video. Please reach out to your educator or leadership for further questions. Happy blood culturing!